Let's start with lots of stories I've seen lately. You probably have too. You can start with the link between, the possible link, the stories of a link between the mRNA COVID vaccines and myocarditis. Let's start here. What is myocarditis?
So myocarditis is an inflammation of the heart muscle. And in some of the reports, you also see reports of what's called pericarditis, which is an inflammation of the sort of sac that the heart sits in. So those two things are in the reports, both. So and what we're seeing and what CDC is reporting and now reviewing intensively is that there has been an uptick in the number of cases of myocarditis and pericarditis that is coincident with, it seems to be, receipt of the mRNA vaccines, both Pfizer and Moderna, in young adults and some teenagers, particularly within just a few days after getting their second dose of one of those vaccines.
Yeah, I had seen there were I think the number was something like 800 cases, and half or more than half of those had been in under 18-year-olds. Is it gender specific? Is it more males than females? Break that down for us also.
The data they've released so far is, yes, it's more common. It's more common in males to begin with, but yes, we are seeing it more commonly in this review of data in males, and the reports are more in males, exactly.
How dangerous is this? Is it treatable? What are the symptoms? What should folks look for?
Yeah, it is treatable, and so number one, we see myocarditis and pericarditis caused by lots of different viruses, so we're very familiar with it. It is can present as chest pain or chest fullness. Shortness of breath is a common symptom, and also fatigue. And the cases that they've been reported in depth on, about 400 cases, they have said that all of those who've been affected have recovered and gone home, without any long-term consequences. So it seems to be a transient phenomenon, which it is with most other viruses that cause it. And they're looking in depth at the data and of course, they look at each case like they've done in other things that have popped up, those clotting with the J&J vaccine.
I had also seen that in a ton of cases that lots of folks have myocarditis, young people especially, and it's asymptomatic also. Is that right?
That is true. Myocarditis because it tends to be very mild. So and many of those are also asymptomatic as well.
If you look at the numbers of folks across the country under the age of 18, and you break down the numbers of the myocarditis numbers, is it outrageous to make a claim that the myocarditis is almost more dangerous to somebody under 18 than COVID? Is that a crazy thing to say?
Well, I think that's a crazy thing to say, Robert. I wouldn't go there at this point. Again, we're looking at it, and what we know is that in kids under 18, there have been over 400 deaths from COVID itself. And while that's a very small number compared to the adult populations, especially the elderly population, that's more than twice as dangerous as the flu. Typically each year we have a couple of hundred deaths due to flu, and that's 400 families whose lives have been really turned upside down by COVID with the loss of a child. So COVID is still a serious illness and should be taken seriously. And the cases of myocarditis, again, under evaluation. We're going to learn more from CDC as they finish their evaluation. But at this point, there's no change in the recommendation for vaccination. And COVID is definitely more deadly than the myocarditis.
There are also claims that, and you may think of them as reactionary, you can comment on that this wouldn't have happened if they'd studied longer, if they'd done more testing. I think the numbers of tests in younger adults was limited. If they'd only done more testing, this wouldn't have happened.
It is kind of a statistics game, and that, what you can say is that we've, in the original Pfizer and Moderna trials, together, we studied over 75,000 people, and those are very, very large clinical trials. What you have to know is that myocarditis and pericarditis are uncommon to begin with, and so what we're looking at is, yes, the numbers we're seeing now are somewhere 10 to 15 times more common than expected. But you're talking about a rare condition to begin with. So you would have had to study several 100,000 people in the vaccine to even see a few cases. That is to say, we're talking about that this is happening on the order of somewhere around 10 to 20 cases per million people. So it's still very, very uncommon. And it is more common, it seems to me that it's more common after these vaccines compared to the norm, the expected numbers, and you'll see those published. But it is still a rare event, 20 to 30 out of a million.
So you're at the hospital today and somebody comes up and grabs you by your white-coated lapel and shakes you and goes, "Doc, myocarditis, COVID vaccine, what should I do?" What do you tell them?
Right. Get vaccinated. This is a rare event, just like we've talked about before. And if you want to wait for a little bit of more reassurance from CDC, that's okay. But get vaccinated. Vaccines are safe.